Here at Stanford, we are an internationally known leading academic medical center. We bring together the best and the brightest and some of the most talented people there are in the world. We have an amazing culture of innovation, and we take that innovative spirit, and in everything we do, we try to think about, what does tomorrow bring?
One place we've really excelled is in multidisciplinary care. When one comes to Stanford, one doesn't just have one doctor. We have teams of doctors, and that leads to our ability to take care of very complex cases.
All the patients in the laboratories and the clinical trials, they're all within stone's throw of each other. So you can meet someone in the parking lot and cook up a new collaboration, or you can see a patient and ask how they're doing.
At Stanford, we've got everything within a few hundred yards here. We're a community of scholars.
What makes Stanford such an incredible place is we truly have the opportunity here to help heal the world. We can do that through our leading edge research and innovations, and we've had cutting edge breakthroughs developed here at Stanford that have propagated around the world.
The cyberknife, endovascular treatment, endoscopic treatment through very tiny openings, the use of computer-directed navigation.
Dr. Shumway in 1968 did the first heart transplant here at Stanford, LVAD therapy, balloon angioplasty, and other major discoveries.
We have the unique capability of taking some of the world's leading science and applying it clinically. Many people have called it bench to bedside, but it's actually much more than that. It's also taking observations on patients, taking those observations back to people who are doing basic investigations, and really understanding mechanisms of disease.
We have a remarkable opportunity to truly center our care around our patients, delivering outstanding, compassionate care 24/7.
The doctors, the nurses, everyone's involved to make sure that you're safe and you're cared for.
We all strive to provide excellence in patient care. We want the overall patient experience to be phenomenal.
How are you feeling?
Having that unique experience with patients can be powerful, it can be motivating. And when you're sick and when you're thirsty and you're tired, you want someone who's going to be able to recognize that and help you along the way.
I cannot say enough about the Stanford people. The care I've received has been outstanding.
Going to Stanford, just the reputation of the hospital and the school was enough to put me at ease, to be honest.
The way I was treated at Stanford was wonderful. It was as pleasant an experience as something like that could possibly be.
The care at Stanford, just awesome. You couldn't ask for any better.
When I was first told that I needed to get a double lung transplant, I didn't know if I was going to live or not. A lot of people don't get second chances, and I did.
Stanford, of course, is a teaching hospital, and I think that teachers are born, not made, and I just felt as if I was in very good hands.
I just feel so lucky and so thankful that I had great doctors. They did a miracle because I was given the worst sentence and I ended up having really a result that no one expected.
Patients come to Stanford Hospital because they're confident that they're going to get the best treatment in the world.
We pride ourselves in taking on the most challenging cases, patients with the most complex diseases.
Having the outstanding people here and the motivation to do something that will make a difference is what makes Stanford special.
We're all working toward the same goal, and that's to get the patient the very best care that they can receive. It's a very unique thing to be a part of.
We need to make sure that the next patient who walks through the door gets the absolute best in patient care with the highest quality, the highest level of safety, with great compassion. And if we do that, then we will make a big impact one patient at a time, and collectively we'll make a significant impact on healthcare here and around the world.